CAISS exam, latest actual exam and practice exam with complete questions and correct detailed answers. Question 1. When assigning severity codes, the coder should use the physician's description of the injury or the ACE definition. ACE definition. ACE definition. Question 2. If the physician's OIS grading differs from the ACE definition of the injury, which should be used for coding? ACE definition. ACE definition. Question 3. If no description is available for a solid organ injury other than the OIS grade, is it acceptable to use this information for assigning an ACE code? Yes. Yes. Question 4. T/F. In order to assign an ACE code with blood loss 20%, you must know to what area of the body the blood loss is linked. True. False. True. Question 5. Are dimensions of lesions used to determine injury severity? Yes. Yes. Question 6. In an adult, 100% blood volume is considered approximately how many cc? 5,000 cubic centimeters. 5,000 cubic centimeters. Question 7. T/F. The severity of codes in ACE are not age-adjusted in some categories. True. False. False. Question 8. Fractures may be best described in what type of report? Radiology. Radiology. Question 9. Organ injuries may best be described in what type of report? Operative. Operative. Question 10. Can patient or bystander reports of LOC be used for coding purposes? No. No. Question 11. Which type of report is highest on the ranking of most reliable sources of injury information? M.E/autopsy reports. M.E/autopsy reports. Question 12. List the 8 types of hospital/medical record reports from highest to lowest rank in reliability of injury information. 1. Autopsy. 2. Operative. 3. Radiology. 4. Nursing/ICU. 5. MD progress notes. 6. Ed record. 1. Autopsy. 2. Operative. 3. Radiology. 4. Nursing/ICU. 5. MD progress notes. 6. Ed record. Question 13. 7. D/C summary. 8. Face sheet. What is considered the least reliable source of injury information? Patient. Patient. Question 14. List the 7 injury descriptions included in the ISS external body. Region. 1. Abrasion. 2. Contusion. 3. Laceration. 4. Avulsion. 5. Degloving. 6. Penetrating. 7. Burn. 1. Abrasion. 2. Contusion. 3. laceration. 4. Avulsion. 5. Degloving. 6. Penetrating. 7. Burn. Question 15. A rubbed or scraped area on skin or mucous membranes caused by contact with a rough surface that removes layers is known as what? Abrasion. Abrasion. Question 16. Road rash and friction burns are considered what type of external injury? Abrasion. Abrasion. Question 17. Black or blue marks resulting from blunt force causing tiny underlying blood vessels to burst and leak into skin but do not cause a break in the skin are known as what? Contusions. Contusions. Question 18. Ecchymosis, subcutaneous hematoma, bruise, and bump are all considered what type of external injury? Contusions. Contusions. Question 19. Tearing or ripping apart of tissues from blunt or penetrating forces. Known as what type of injury? Laceration. Laceration. Question 20. Ripping or tearing away of all layers of skin in which a portion is separated from underlying tissues, often creating a flap, is known as what type of injury? Avulsion. Avulsion. Question 21. Traumatic removal of skin and SQ tissue separating tissue planes from their blood supply, especially from a limb, is known as what type of injury? Degloving. Degloving. Question 22. T/F. Degloving injuries may be open or closed. True. False. True. Question 23. Which are typically more extensive, degloving or avulsion? Degloving. Degloving.